John Wooden was from Muncie, Indiana, and he made this comment. He said, ability may get you to the top, but it takes character to keep you there. So for me, what that says is you must constantly study, you must constantly upgrade your knowledge and your talent to stay at the forefront in medicine of manipulation performed by chiropractors. And this was true of my clinical internship at National. Dr. Blackmore would say, come with me, young doctor. We will go into this room with this special table, which I learned later was called a McManus osteopathic table. And he would treat them there until they were out of that acute pain. And then he'd say, okay, young doctor, you take over with the case. I didn't get the idea. I didn't get the picture at the time. I read the following books, The Manual of Osteopathic Technique by Alan Stoddard, the writing of John McManus, who was a DCDO. Yes, he eventually went to National, became a chiropractor in the 30s and instituted his work there from the Kirksville College of Osteopathic Medicine. I had the mentorship of my stepfather, John Rodman. That happened, and then what happened? Well, I read these things about osteopathic technique, and Alan Stoddard said about this vascular supply, he said there are no valves in the veins of the brain and the cord. Pooling and congestion are quite common, slowing down circulation within the central nervous system. To ensure adequate venous drainage in the vertebral column, all intervertebral joints must be freely movable. Alan Stoddard wrote that on page 232 of his book. I thought, wow, what a new area to study. He said degenerative changes in any tissue is caused by increased aging and by reduction in blood supply to the tissue. He said manipulate and mobilize somatic dysfunction of the spine before it leads to degenerative changes. Makes you think, doesn't it? What would happen if people did the proper exercises, the proper nutrition and metabolic health, chiropractic manipulation, ergonomic training, young in life, to avoid or put off the degenerative changes that ultimately lead to spinal stenosis?